The National Institute of Mental Health has defined anxiety as a feeling of worry, nervousness, and unease. So at one point in our life, we've all experienced anxiety, whether it's in small doses or large doses. So it's fairly common with us. But what we don't really realize is that anxiety affects us more than just mentally, but physically. So according to the Brain and Behavior Research Foundation, 40 million people suffer from chronic anxiety. And when we look at adolescents, we see that more than half of them suffer from lifetime prevalence of some sort of anxiety, whether it's low anxiety or high anxiety. And this could be from school, it can be from sports. Being a teenager is a very stressful time. But then we have a small amount that does have a lifetime prevalence of severe anxiety, whether this is a disorder or goes along with a different complication. And when we look at demographics, statistically, age and sex are not different. It occurs a little bit more in females than it does in males, but not to the point where one is significantly more than the other. And throughout age, it tends to stay pretty steady. When we talk about our race, though, statistically, whites are more likely to suffer from anxiety. So we talked about how it has both effects and it's common, but anxiety can be positive when we talk about our fight or flight reaction. Small amounts help us react in a primal way to keep us safe, but it can also be debilitating if there's too much anxiety and we're constantly in a fight or flight reaction when we don't need to be. Physical effects are increased blood pressure, heart rate, respirations, and our 5 senses. So it makes us hyper aware to our surroundings. It helps us react accordingly, but sometimes our body goes into overdrive, especially when we have too much anxiety. So the brain and the Harvard Medical School said that it can be linked to physical complications like IBS and heart disease if we have too much, and that's usually with people who have disorders or severe anxiety. And then we go to our mental effects. A lot of us have racing thoughts, so we can't concentrate, or we have extreme concentration on one thing. There is feelings of dizziness. Some people think it could be linked back to the physical effects about how fight or flight blood is shunted to only vital organs. Now when we go deeper into anxiety, and when it becomes more severe, people have said that they feel trapped, they feel hopeless, there's a need to escape when there's not actually a rational reason behind it. So mental disorders are common and need to be treated as well as effectively managed so people can hold meaningful relationships and they can function in daily life. So all in all, anxiety is fairly common. We've all experienced it, but we always kind of put it in a mental perspective and don't really think about how it affects us as a whole physically. It is extremely important that it's talked about both ways because it's helpful, but then yet it can be harmful. We just have to distinguish what's best for us.